Good morning, everyone. Good morning. Thank you, Mr. Liu. This is Victor Gao. I'm in the CCG headquarters in Beijing. I'm very happy to join this webinar together with you. I think we will start very promptly at 9 o'clock, and the whole webinar will be 1 hour and 30 minutes. So the speakers will speak for about the first hour, and then we reserve the last 30 minutes for Q&A sessions. And now I see so many of our panelists are already gathered here on this virtual webinar. So without further ado, with your permission, shall I start the webinar right now? And we are gathered here today on a very important occasion, because we know for sure that mankind has been plagued by this COVID-19 pandemic, and there is no sign that on a global scale it is getting better anytime soon. So I think we need to make more noises, make our opinions known, so that international cooperation can be strengthened rather than weakened in terms of mankind's fight against this pandemic, so that more lives can be saved, less infections will happen. And if we look across the world, either in terms of major continents or major countries, for example, or countries of any size, there are different ways in dealing with this pandemic, and different governments have adopted different theories, paradigms, methods in terms of fighting against this pandemic. I think historians in the future will have a busy time in doing their analysis of the pros and cons, the highs and the lows of the global effort in terms of fighting against this pandemic. We know for sure, as of today, there are more than 22 million infections in the world, and unfortunately, more than 750,000 of people have sadly passed away. So allow me to use this occasion to express our condolences to all those who passed away because of the pandemic, and to express our sympathy for all those who have been infected, as well as their family members, etc. We hope they will recover soon. And we today are gathered here to talk about the international corporations, focusing on bigger countries or larger countries, or sometimes we call them major powers, even though it may not be taken very lightly by countries or people in many other parts of the world. I would emphasize that international cooperation is a must, is absolutely necessary. And I hope all countries in the world can rally around the WHO to strengthen international cooperation against this particular pandemic, but also more generally against any major virus attack which may happen in the future. We have lots of distinguished panelists, including Dr. Wu Junyu of China CDC, Professor Thorsten Altmans of Germany, Dr. David Dollar of the United States, the Brookings Institute, Dr. Huang Yanzhong, who is Senior Fellow for Global Health at the Council of Foreign Relations, the dear Professor George Han, who is now in Boston, I suppose, and Professor Stanley Perlman, Professor of Microbiology and Immunology, Professor of Pediatrics, etc., in the University of Iowa. And also, last but not least, Dr. Zha Daojun in the Beijing University. So we will very quickly move on to our main theme of discussions today, which include the following key points. Cooperation between major powers. How will COVID-19 reshape relations between major powers? Will China and the United States collaborate more, or is such cooperation less and less possible in the future? How can different countries come together and cooperate against all kinds of resistance and stigmatization. The second point is about vaccine development, which is probably the most important thing today in the world. Vaccine development and distribution as related to global epidemic control. The third point is how can we work together to get stakeholders involved in public health management to do our job together. And the fourth point is equitable access to health service. We see the dangerous sign of certain countries try to monopolize vaccine or to buy out all the potential supply of vaccine for its own people, rather than coming up with a more balanced and equitable global strategy, making sure that countries and people in those countries hard hit by the pandemic can have equal access to vaccine. And last but not least, the coronavirus trend. What are the future trends of COVID-19? Will life go back to normal soon, or does the world have to live with this virus for a long time? What will a normal life look like after COVID-19? So these are the main topics, and I'm very happy that we are joined with such a panel of distinguished scholars, former politicians, practitioners in the world from different parts of the world. So without further ado, allow me to give the floor to our first panelist, Dr. Wu Zunyou. He's the chief epidemiologist at the China CDC. And because he has another important meeting to go, so let us give him the floor first so that he can share with us his views as well as CDC's views on these major topics in the world. Dr. Wu, you have the floor first. Thank you, Dr. Wu.
Great. Thank you, Mr. Gao, for your introduction. Let me share my screen. Again, good morning to Chinese panelists and good evening to American panelists and scientists in the other regions. So I'm going to talk about cooperation to control COVID-19. I will very quickly to bring you back to very earlier 3 weeks of a response to the initial identification for COVID-19 outbreak. On December 27, initial cases of pneumonia was noticed and reported by a doctor in Wuhan. On December 30th, alert was issued by Wuhan Local Health Authority. On December 31st, the National Health Commission and the China CDC involved in the investigation of the outbreak. They identified most of earlier cases had a common exposure to Huanan seafood market. The market was closed immediately after the day on January 1st. On January 3rd, we reported the epidemic to WHO and other countries. Even we do not know etiology, we informed WHO and other countries there's an unknown pneumonia without etiology. So it may have a big outbreak. So now we are continuing work on to investigate. On January 7th, SARS-CoV-2 was isolated and identified as a pathogen for this outbreak. China informed WHO etiology assessment result on January 9th. On January 10th, RT-PCR test kit was sent to Wuhan for clinical diagnosis. Started from January 11th, we started to report outbreak statistics to WHO daily. On January 12th, we shared virus sequence with the WHO, and we uploaded the sequence to the global database. By sharing that sequence, every country could use that sequence to develop their own diagnostic test kits. On January 20th, COVID-19 was added to notifiable diseases in China. On January 23rd, Wuhan City put on shutdown or central sanitary, and in the following few days, 15 other cities were put in the shutdown. So review that first 3 weeks, I think it takes us only 7 days to identify pathogen and only 2 days to develop test kit. That's very fast. Probably we create a new world record to recognize infectious diseases in such a short time. So look at the first few weeks. I think 4 important scientific findings generated in the first 3 weeks. Isolating virus, identify pathogen for the outbreak. We sharing the sequence that could be used for developing test kits. We determine the incubation period, how many 3 to 7 days, 9 to 14 days, and also transmission mode, droplet, and contact. All these 4 scientific findings laid a scientific basis for control strategy. Now, in the first 3 weeks, we have a few points to highlight for international cooperation. Very early, in January 3rd, even we do not know the pathogen, we shared information with WHO and other countries. When we talk about other countries, what do we mean other countries? Other country means United States, Japan, Korea, United Kingdom, Germany, and other European countries. So after SARS outbreak in 2003, we set up the routine communication mechanism to communicate once we have the infectious diseases. And also 4 important events in the January for the international cooperation. First, we share information about epidemic. We shared etiology information. We started reporting our outbreak daily to WHO. We shared virus sequence. All of these events are international cooperation. So let's look at update epidemic of COVID-19 in the China. In the China, we could divide the epidemic into 4 waves. The first wave, the initial epidemic in the January and February. So the epidemic was brought under control by early March. Then we have a second wave, it's imported cases and related local transmission. Then we have a third curve, it's outbreak in Beijing. And we have 4th outbreak in Liaoning and Xinjiang. So now we are back to zero local cases now. So to summarize the lessons we learned in the response to the COVID-19, we have total 8 lessons. The number 6 is international cooperation. We emphasize international cooperation. We believe international collaboration is very important to control the pandemic. So in order to facilitate international cooperation, China has started its activities since January, very earlier. So with the support from China National Health Commission and the Ministry of Foreign Affairs, we have organized virtual communications with over 150 countries. So that organized communication is very important to share information about epidemic and share lessons we learn. And we also have direct communication with the United States. the two CDC, China CDC, US CDC, has kept a regular technical communication. In the early January, the director of China CDC and the US CDC director, they have telephone call to communicate. We also have regular, at least once a month, sometimes twice or three times a month, for technical communication between two CDCs. We also have a non-governmental society, association, or academic institute for communication. The one like we have today, it's a non-governmental organized communication. The challenge we face, how we can put that communication on the basis for government sector. So that's a challenge. Here I have one more example for China CDC and the collaboration with the US technical agencies. Dr. Tony Fauci, he is the director of National Institute of Infectious Diseases and Allergy. He recently, China CDC director invited him to have a review article published in the China CDC Weekly. So that channel is still open. So that's the end of my presentation. Thank you for your attention.
Thank you very much, Dr. Wu. I think we all thank you very much for the great work you and China CDC have been doing over the past several months. The chronology you just now presented is not only your hard work, but I believe also carries the signature and the blessing of China CDC. And this is a chronology that will be analyzed in great detail by mankind for many generations to come, because this is very solid, and I think this is against all kinds of false accusations and allegations, and I hope we need to allow science to prevail politics, and we should not be swayed by innuendo or accusations. And I thank you for all the great work. What you are doing is not only saving the Chinese people, but very importantly, saving mankind as a whole. And I understand China CDC and US CDC have cooperated very closely for many years. And there have been a lot of exchanges of experts, professionals, etc., and more recently by webinars like this. And we are all grateful for such close cooperation between professionals of China and the United States. And I personally believe such cooperation is crucial for international cooperation, and this speaks the best of the decency and the dignity of the Chinese people as well as the American people. I understand Dr. Wu needs to be excused for a while. He may have time to join us at the end of the Q&A session. So, Dr. Wu, thank you once again. And hopefully we will welcome you back very soon. Thank you, Dr. Wu. And next, please allow me to give the floor to Professor Thorsten Altmans, who is a professor in the China University in Germany. Professor Altman is in Germany right now, which is 6 hours behind the Beijing time, so it's very early, about 3 o'clock in the morning. So thank you very much for the great work you put in, Dr. Altman, for staying up late, very early in the morning to join us and the global audience. And we will be very carefully listening to you. And after you made your speech, you can go back to bed and get some sounding sleep, I hope. Thank you. Please, you have
Ni hao, and thank you very much from Berlin. It's a great honor for me to be here. I just want to familiarize you briefly with some work we've done, even actually starting before Corona hit, on the question of how do countries actually fare when it comes to public health and public health management. I'd like to briefly highlight the methodology and then come to some of the findings that pretty much make the point and support the point of international cooperation and the stakeholder management, as we called it, in order to get some of the efficiencies and also reap some of the opportunities of the different health systems. I will not show any slides because I was told sometimes this causes some technical problems. But if any of you want some further information, I'm happy to share slides and also the figures. Now, as I said, even before Corona, we've seen more and more governments developing an interest in effective and efficient ways to manage public health. And some of them pretty much focus in the first place on NCDs, and which are pretty much responsible for about 75% of the deaths worldwide and rising. So the quest for an optimal policy mix is made more difficult by limited comparability across national borders, as you know, and there are independencies between policy measures, prevalence data, and diseases frequency always transparent. Based on intensive discussions within our network with our clients and with external experts, we have developed a special index, the Public Health Index, and that comprises 88 countries on which it is represents about 86% of the world's population and more than 95% of global economic output, GDP. So we gathered a lot of data, actually about 18,000 data points from publicly available sources. We did more than 5,000 additional calculations for about 212 sub-indicators, and all of these pretty much, as I said, based on publicly available data. The aim was to provide all kind of parties in the public health management domain information to actually help them to benchmark their own systems, and also to develop a kind of approach to increase public health services. And we kind of focused on 5 dimensions, if you will. One is the stakeholder involvement framework, the way and the extent of how public health policies include stakeholders and database evidence in their decision process. And I'll come back to that later. Modernity and innovation framework, are policymakers open to innovation and support disruptive technologies to foster a modern, innovation-friendly environment? Third question was about accountability and safety framework. Does the government create policies that support health infrastructure in terms of quality standards, access, and equity? The fifth question was around regulation and prevention framework. How much value is placed on prevention of NCDs and environmental mobility hazards? And the fifth point was on tracing comprehensive public health approaches. Do governments adopt a balanced approach to combining restrictions and direct interventions with information, incentives, and support for people struggling, for example, from addictions and unwanted behavior? As I said, we've run the first kind of study before the pandemic hit, but still some of the findings might be still interesting, and I'll provide you with a first glimpse on an update at the end of my speech. Some of the findings are probably interesting in this context. Good public health unfolds within a comprehensive management framework. That was our point. I think it needs to be pushed forward much more than before. This kind of framework that I laid out, the 5 points that kind of combined to a smart framework in the end, that actually show that different components, and especially the one of international cooperation, pretty much support the performance of the public health system. Yes, not surprisingly, GDP is a major driver of the quality and scope of public health system, and improvements in public health correlate strongly with economic growth. That's not that surprising. But although the correlation is very strong in 2 dimensions, the PHI, our kind of index, does not depend on GDP alone. 3 other factors make it clear that good public health management is not determined solely by national income. The SMART framework helps isolate specific areas of action and shows how the individual components can be improved, even for those countries who are not that affluent and not able to invest heavily into their health system. Let me give you one example. Bangladesh, for example, scored number 2 among the lesser developed countries in this public health comparison in the sub-index of stakeholder engagement, meaning the country is a member of the National Engagement Strategy, the Joint Learning Network, seeking to apply best practices in order to actively fostering stakeholder engagement. And key lessons learned are there are complementary policies helping universal health coverage to achieve full coverage by 2032. Member of the Joint Learning Network means they are enhancing reform capabilities, improve stakeholder communication. There are monitoring tools in place to actually adopt and take into account what other countries have already developed. And the overall kind of approach that has been seen very, very successful here in a place that at least we found very surprising is that the country is actually pretty much involved in international policy making, international best practice exchange, the flow of international science data in order to improve the health system, although the overall GDP data would probably not actually speak for an excellent system when it comes to the overall performance, given the restrictions of the budgetary opportunities. So if we look at the results of our study, we see that the right balance actually is what counts. Countries adopting a balance between the interventionist approach and measures based on prevention, voluntariness, and harm reduction achieve better results in terms of steering consumer behavior and prevalence data. That means countries who actually not focus that much on either or strategies, but try to kind of establish a system that is actually reducing risks and harms in different areas of life. For example, when it comes to tobacco or when it comes to alcohol or sugar or something like that, fare kind of significantly better in improving the overall health system. So it's a question of philosophy, if you will, and of the overall idea to manage and balance different risks rather than trying to avoid a certain risk totally. So there's remarkable different approaches to risk factors. Countries in general more intervening with regards to tobacco, for example, or alcohol or sugar. And there are others who actually follow a pretty balanced approach. And that kind of somehow is significantly correlated with the value placed on prevention. Pretty much kind of affects the overall approach towards, for example, reducing NCDs. Now, why is this interesting for us in the connection of COVID-19 and the international cooperation? What we see is these systems who are actually already by itself designed to include stakeholder perspectives on a national as well as on an international scale are doing pretty much better, even if they don't have the money, to say it boldly, to invest that much into their system. The strategy to kind of adopt to best practices and kind of increase the overall performance of the health system is gaining effect for all the citizens and for the overall standard of the system. And that also goes, if we look at how these countries actually dealt with the pandemic. We've done a first research already, including 68 of the 88 jurisdictions we had in the initial sample. We put in a lot of data on the, for example, stringency of the government response at an early stage, stringency of government response on average, indicators of kind of different performance measures towards COVID-19 over time, and also looked at the measures to flatten the curve pretty intensively and very fast. And we see some very positive relations between those countries who actually adopt a balanced approach towards public health management, who are especially trying to open up their countries for international cooperation and their score in fighting the disease. Some numbers here, there's a very strong positive correlation between those countries who actually do follow this balanced approach and the successful flattening of the curve, that is with around 40%. Those countries who follow a balanced approach towards harm reduction, for example, fare the best when it comes to the reduction of COVID-19. That means those countries follow the philosophy of balancing out risks rather than trying to avoid risks totally And in this, kind of relying on international cooperation and international best practices, are 40% better than those countries who follow a pretty much strict and very, very kind of conservative approach towards health management. And there's also a very positive correlation between the PHI index, meaning these balancing out these five levers to improve public health, and the ability to react fast and introduce fast measures, which is, I think, correlated with around 25 to 30%. Again, meaning that overall, I'd say that the results of these studies shows that those countries who are actually pretty much involved in international, not only kind of measurements, but also involved in the international exchange of knowledge and kind of best practice sharing, and they obviously fare around 50% better in coping with the corona crisis than those countries who are pretty much relying on themselves. And that, I think, is a strong argument for international cooperation and kind of stakeholder involvement on a broader base. Thank you very much.
Thank you very much, Professor Altman, and we are grateful for your serious scholarship on this very important issue. What you emphasized about the role of intervention, prevention, change in social behavior, etc., and coming up with a systemic structure in dealing with this pandemic is absolutely important. I would say that scholars in the world for the coming few decades will be very much focused on doing analysis and scholarship about this pandemic and how different countries and jurisdictions reacted to this pandemic. And hopefully your scholarship and your work will yield significant results for future generations of mankind as to how to detect, report, fight against, contain the pandemic if it ever raises its dangerous head to haunt mankind. Thank you. And it's very early in the morning. I hope you'll get some sound sleep. And I hope when you wake up, it's another great, beautiful day for mankind. Thank you, Doctor.
Thank you very much. If you allow, I'll stay for a while and listen to some of the colleagues as long as I'm able to stay awake. Okay.
Thank you. Thank you, Professor Altman. Now, I have the great pleasure to give the floor to Dr. David Dollar, who is a senior fellow with Foreign Policy and Global Economy and Development Program at John L. Thornton China Policy and the Brookings Institute. I've known Dr. Dollar and met with him on many occasions in China and elsewhere. Although I have many friends in the United States, Dr. Dollar is one that I want to keep as a close friend. I think it's a pedigree to tell everyone I know that I have Dr. Dollar as a friend. So, Dr. Dollar, the floor is yours. And given the time constraint, I hope each panelist will speak up to 6 or 7 minutes. Thank you very much, Dr. Dollar.
Thank you very much, Dr. Gao. It's a great pleasure to see you electronically and to join this distinguished group. We're living in an era of great power competition that's primarily between the US and China, but there are other important countries in the world, so-called middle powers. And the main point I want to make is I think this era of great power competition is bad for global governance. I'm not a health expert. Other people in this panel are health experts. So I'd actually like to broaden the discussion a little bit to take up this point that we're really not doing a very good job with global governance. And a lot of it comes down to poor relations between the US and China. So I want to use 3 examples just very briefly. And I'll start with public health because that's our main topic. But as I said, I'm not an expert. But we heard from Dr. Wu of China CDC, the Chinese view about the discovery and the treatment, dealing with the COVID-19. Let me just say in the United States, there's a somewhat different impression. Our Congressional Research Service did a recent study, and my lay summary is that we basically, as a world, lost 2 to 3 weeks because local Chinese officials and some Chinese officials, central officials, were not really passing on information and dealing with this in a transparent way. Now, I don't want to get into an argument about which view is right, because from my point, all I need is this emphasis that the 2 sides just see things very differently. You know, China and the US do not agree about the origin of the virus and the early stages of dealing with it. I would also quickly add the United States has obviously done a very, very poor job dealing with the virus. It's pulled out of the World Health Organization. So it's just really hard to praise any collaboration. Well, I'm sure there are lots of specific international collaborations among researchers, universities, et cetera. But in terms of global governance, we have not done a very good job, and that does not bode well for the next pandemic that comes along. Now, as I said, I just want to broaden this a little bit because I think this is a more general problem. So my second example is global climate change. It would be a shame if we forgot about climate change while we're dealing with the pandemic. And there, we had good news a few years ago when China and the US teamed up with other countries to sign the Paris Accord. But right from the start, both China and the US had not really very ambitious targets for carbon reduction. So if you're a citizen of the world, it would be easy to be disappointed in both China and the US in terms of their ambition for carbon reduction. And then the US pulled out of the Paris Agreement, so now it really has no target for carbon reduction. So another important area where we really don't have effective global governance. And then my third example, very closely related to the coronavirus. We see the virus spreading in a lot of countries. It's interesting to me that it doesn't seem to be spreading that much in a lot of Africa. That may just be weak health systems and a lack of testing, but it doesn't seem to be such an epidemic health-wise in many African countries. And yet there, the economic crisis is really devastating. Because countries' exports have dropped and prices have dropped, you have very serious falls in GDP around the continent. So you're going to have a lot of health and other problems emerging because of this very serious economic recession in Africa. And what's happening there is many African countries cannot service the debts they've built up. And a lot of that debt is frankly to China, but they also have debt to other official creditors and to private bondholders and to the World Bank, et cetera. So we're probably going to need a coordinated global effort to help the poorest countries. And we got a good first step at the last G20 meeting, where China and the US and all the other G20 members agreed to a debt moratorium for 2020, no debt payments for the poorest countries for the rest of the year. But that's a very small first step. It's not debt relief because the interest is still accruing and interest and principal will have to be paid after January 1. Many countries are going to need more significant debt relief. They're going to need IMF programs, and they're going to need what would normally be Paris Club reschedulings. And this is another area where our global governance is really lacking. In my professional view, the IMF needs additional resources, but the US is opposed to expanding the IMF quota because if you follow the usual formula, China's weight would increase, India's weight would increase. The US is resisting bringing more power of the emerging markets into the IMF, and that's holding back the resources. And then China on its side is not a member of the Paris Club, and it's not coordinating with other official creditors. So I look around the world at what I view as some of the key global challenges. And right now that would be this health pandemic, global climate change, and debt problems, balance of payments crises in poor countries. And I really see a failure of the United States and China to provide leadership. I'm an American, so that probably undercuts the credibility of some of the things I'm saying. But if I could put on my hat as a citizen of the world, I think there's reasons to be disappointed in both the US performance and Chinese performance in these areas of global governance. Thank you very much.
Thank you very much, Dr. Dollar. I think we are grateful for your very overarching global view of some of the major issues mankind as a whole is faced with. And either in terms of pandemic, climate change, African issues, or other global development issues. I think all these are very important issues and they demand a global solution. And the fact that China-US cooperation is collapsing at this very moment is really very sad and is a disappointment. Allow me to emphasize one point. China is a beneficiary of the existing international order that we understand over the past 41 years. And I think China has all the eagerness to continue to operate within the existing international order. The existing international order needs some modification, of course, but China has no desire nor the wildest dream for a complete revolution, overthrowing the international order. And I hope decision makers in Washington would also see this issue in the same light, rather than, for example, keep pulling out of the existing international order. And I think historians in the future will judge that the US government's decision to withdraw from WHO in the midst of this global pandemic is probably one of the worst decisions that the US government has ever made in history. And this is really a shame. And we need to really call for restoration of sanity and rationality in Washington. And I appeal both China and the United States to bury whatever differences there may be and engage with each other, not only for the good of the two countries, but for mankind as a whole. If, for example, we are faced with an alien invasion from the deep space, probably international cooperation is the worst, and mankind is not well equipped to deal with an alien invasion like this. Thank you very much, Dr. Dollar, and I hope we will continue to get your benefit and wisdom on many of the issues going forward. You have a lot of fans here in Beijing. Now, allow me to give the floor to Dr. Huang Yanzhong, who is a Senior Research Fellow of CCG, but also a Senior Fellow for Global Health at the Council on Foreign Relations. Dr. Huang, you have the floor, please. Thank you, Dr. Huang.
Well, thank you, Dr. Gao. Really, it's a pleasure to be here with a distinguished group of experts to speak in this session. I'm asked to address this question on the cooperation between major powers. One of the questions is how can different countries come together and cooperate against all kinds of resistance and stigmatization? Will China, US collaborate soon? I think instead of addressing this question, I think it would be equally interesting to address, the issue of lack of cooperation in addressing the current pandemic. And we've seen, essentially in terms of status, international cooperation, it is fragmented, it is uncoordinated, it is essentially state-centric, right? So there's a lack of cooperation of vaccine development and distribution. There is the lack of coordination of travel and trade measures. There are no substantive steps to help poor low-capacity countries in fighting, the COVID pandemic. When we want to explain, why there's such a lack of cooperation, right? We could turn to these two leading international relations theories, the neorealism and neoliberalism, right? Neorealism, this is just some of the ABCs, on the theories, right? Neorealism basically is concerned with the distribution of power and the international system. Basically they say because we don't have a world government, we are in an anarchic situation. So that leads to two problems for international cooperation. The first, because self-help is the main principle, because of that competitive dynamics among countries, states seek relative gains, not absolute gains, and that makes it difficult for states to trust each other and cooperate. And secondly, states try to protect themselves by maximizing their power and influence. That in turn leads to another problem in the realist concept, that is security dilemma. The second, when we so this is the neorealism. When we look at the neoliberalism, while this liberalists would agree that on anarchy, balance of power, self-help in the international system, they highlight how there's supranational actors, transnational corporations, NGOs could facilitate interdependence and integration between states that would make cooperation more likely. But they also highlighted two obstacles to cooperation. Well, the first is a lack of robust international institutions, organizations to create, promote, and enforce norms and rules, right, for effective international cooperation. Right. The second obstacle is what some call this massive democratic deficit at the global level. We're going to explain what that is, next. When I explain how these two theories will help us, explain why there is a lack of cooperation among major powers, especially between U.S. and China. Right? So if you apply the realist approach to dealing with this pandemic, we know that we live in a world, again, without a world government. So self-help remains a dominant principle driving countries' external behavior. But that is reinforced also by the fact that this pandemic is heavily, quote unquote, securitized. Basically, it's presented as an existential threat, that requires emergency measures, justifying actions outside the normal bounds of political procedures, right? So that the pandemic that affects every country, then combined with this logic of existential threat, essentially relieves the states of any moral obligation to help other countries in responding to the outbreak. And so the vaccine nationalism provides a very good example of that self-help principle. And secondly, we have this problem of uncertainty and fear, right, associated with the pandemic. That gave rise to the prevalence of conspiracy theories in both countries, the United States and China, that also reinforces security dilemma. We have seen China ask for the United States to recently to fully clarify the U.S. overseas biological activities. Right? And the U.S. was concerned about the possible lab escape, right, of the virus in China. So this is just an example of the security dilemma being reinforced during the pandemic. And that pandemic is also associated with this growing concerns about the so-called relative gains, right? Basically, the U.S. is concerned about China taking advantage of the United States. So that is why they did not want the cooperation with China, for fear that China would benefit more from the process, especially over the issue of the vaccines or new drug development. Because again, the cheating here remains a major concern. So that is the neo-realist explanation for the lack of cooperation. And then we look at the liberalist explanation. The 2 points, but the first is the lack of robust international institutions. Again, here we found that despite all these good things WHO has been doing in the pandemic, the WHO lacked leadership in coordinating effectively the international response. Right? These might be different interpretations, but many pointed out that WHO deferred to the member states in decision making. They showed incoherence of important travel related guidelines. There's credibility issues. There's a lack of authority to enforce rules. And even by the United Nations, which played an important role in the 2014 Ebola outbreak. And because of its great power disagreement in the COVID pandemic, there's this stalemate, that prevents the UN Security Council from issuing a powerful resolution to mobilize the UN agencies, and from creating a subsidiary body to provide high-level direction, including to help coordinate the international response in fragile states. And secondly, well, the pandemic also highlights this rivalry between democracies and the so-called authoritarianism, because in this pandemic, the issue of pandemic response was framed, by both the United States and China as a sort of a competition, between two political systems, right? So this morning I attended a seminar where a leading China scholar said that she was so surprised by the way the ideology has re-entered the U.S.-China relationship. So ideology is becoming central to the U.S.-China cooperation. While China highlights the superiority of the Chinese approach and its model, the United States, but according to Secretary Pompeo in his July 23rd approach, essentially framed the competition between the United States sort of as an ideological war, right? That justified disengagement with China, or hard decoupling, if you will. There's also a problem here with the liberalist theory. I think this is probably the only thing that the liberalist theory didn't explain well. That is, they believe that interdependence, integration would facilitate cooperation, but actually the pandemic highlights the downside of globalization and integration, because the pandemic actually, the globalization actually facilitated the spread of the virus and further disrupted the supply chain. So what are the solutions to the problem? We could certainly, right, based on what we have described or what the problems are, we need better communications and dialogues. We need to dispel the misperceptions. We need to minimize the chances of miscalculation. We need to mitigate the security dilemma. The bottom line is that you don't want to open another battlefield on the ideological front. But in the meantime, well, leads to the second point, well, this is the neoliberalist approach, that is, we need to strengthen the WHO, we need to strengthen the United Nations, we need to revise international health regulations to improve member states' compliance with the IHR. We need to reform the outbreaks. We need to involve the UN Security Council and G20 in pandemic response. But I think a more realistic approach is that for both sides, the United States and China, to start talks to coordinate the travel and restriction measures, which are already making the international travel unnecessarily onerous. So I think this presents a more promising area of cooperation between the two, because at the current stage, given this lack of trust between the two countries, we should consider focusing more on coordination, than on cooperation over issues like vaccine development, for two reasons. A, because it is easy to accomplish. And second, trust is a major normative concern in this cooperation game, working with each other in vaccine development. But addressing the issue of coordinating travel restriction measures does not need to address the issue of cheating or relative gains. So that, I think, again, represents a more promising area of cooperation. But of course, right, in order to make that happen, you need to start the dialogue, which unfortunately, right, even to achieve that, now it's becoming politically difficult, if not impossible. So I'll stop there. Thank you.
Thank you very much, Dr. Huang. I think I agree with your underlying message, that is international cooperation, especially China-US cooperation, need to be restored and strengthened, even though there may be some difficulties or odds to overcome. And I think true scholarship is really to be able to focus on many different aspects of the major issues, and nothing in the world today is a very simple question. Each question has multiple assets aspects to it, and each facet need to be closely analyzed. And I thank you for your great presentation. Allow me to give the floor to Ambassador and Professor Hen. He is now a professor at the Pagadi School of Global Studies, Boston University, and he was a former senior public policy fellow at the Wilson Center. And to me, he was the great ambassador of Chile in China. And I think all my friends who know Ambassador Hen in Beijing ranked him as the best, if not one of the best ambassadors in China. And Beijing has never been the same after you and your wife left here. And you are very much missed. And we are always expecting you to come back to visit us again. And Ambassador Hen is not only an outstanding diplomat, he's also truly a great scholar. And his publications are widely known. And one of his publications is in my study, and I constantly reference to his publication. And without further ado, Dr. Hen, the floor is yours. Thank you.
Thank you. Thank you, Dr. Gao. So good to see you after all these months. Thank you for the opportunity. I'm here to learn more than anything. I'm not a public health specialist, but let me share with you in the frame of the discussion of how we can regenerate cooperation and coordination between the big powers. The perspective from what happens in some parts of the world, in this case, I'm going to refer to Latin America, when this cooperation, when this coordination does not exist. And perhaps you're not aware of it, but the pandemic, COVID-19, has hit Latin America particularly badly. Latin America has around 8% of the world's population. And this varies from week to week, but there have been moments in which it has had 28% of the world's fatalities. So this figure by itself tells you there's something deeply wrong in the way the region has managed this big pandemic. The UN's Economic Commission for Latin America and the Caribbean has recently come out with a report. And what they say is that this is the worst crisis in Latin America in 100 years. What we have had is a combination of a social crisis. In 2019, as some of you may recall, we had a number of social uprisings throughout the region, in my own country, in Chile, in Bolivia, in Ecuador, in Colombia, elsewhere. And after that, on top of that, we had the health crisis, the pandemic, that came late to Latin America. As you may recall, it only came late March, early April. You might have thought governments would have been able to prepare for what it would entail. But obviously, they didn't. And in some countries, most widely known is the case of Brazil. Brazil right now has around 110,000 fatalities. Mexico has only been very badly hit, 57,000 fatalities. It's a very dire picture throughout the region. There are a couple of countries that have managed rather well, Uruguay, Costa Rica, Cuba, but they're really the exception. The rule is that countries have been very badly hit. Even those that managed to get it right in the sense of doing all the things they were supposed to do it early, like Peru, they have been very badly hit, among other things, because of the very tight living conditions and housing conditions in Lima and elsewhere, which means that social distancing has been very difficult to organize and to establish. So the point I'm trying to make is that this is really for Latin America, and earlier mention was made of the case of Africa that doesn't seem to have been hit as badly. And there's a great paradox here. Brazil has, by all accounts, an excellent health system. You would have expected that Brazil would have been able to deal with this pandemic in a good manner. Yet it is one of the countries that has been hit in the worst way in the world. Obviously, the question here comes to public policy decisions, obviously the wrong ones that were taken very early on and that turned out to be very, very wrong. So the point I'm trying to make is that in this context, obviously, when you're hit by a pandemic, that by definition is a global issue, a global threat, you would have expected an uprise, an increase in regional, if not global coordination. Yet very little of that has been seen. What we have seen is, on the contrary, an effort to close down borders, a sense of every country for itself, making obviously travel very difficult. There have been problems of, particularly in the earlier parts of this, of hundreds and in many cases thousands of travelers stranded without being able to get back to their countries. A very chaotic environment, which doesn't speak well of the way our countries are dealing with this crisis, with this challenge. And in this context, there have been cases that are almost a caricature. Countries in Latin America that needed to get medical equipment and medical devices, and that many of those are produced in China. They were very leery of bringing them back either through Europe or through the United States, because there was the risk, as it happened in a number of occasions, that those products, that merchandise was actually confiscated and taken over by the authorities of the country it was flying through. So the point I'm trying to make is that for countries in Latin America, this has been a particularly difficult period, a particularly difficult moment. Traditionally, countries in Latin America have depended on multinational organizations, on international cooperation, on working together with the existing global order. And at this point, in which there is so little of it, we have been really finding it extremely difficult to be able to deal with this situation. And on top of that, as if this was not enough, the regional organizations in Latin America are going through a particularly weak moment. We had a number of entities, UNASUR, CELAC, which is still around, but very weak, ALADI in the past, and right now it's basically every country for itself, which again has made dealing with this situation even more difficult. So the point I would like to make is that this pandemic, this virus, has shown to us that we really need to revise the way we approach what international threats in the 21st century are all about. For too long in our countries in Latin America, we have had this rather old-fashioned view that the threats would come somehow from armies crossing borders. Now we realize that a virus can be much more deadly than armies or air forces or navies. And the fatalities that I was indicating before are the best proof of that. So it seems to me we have to adjust our view of what defending the national interest actually is. You would think that defending the lives of your citizens, of your nationals, would be at the very core of that national interest. And if that is the case, obviously we are not prepared for it with a very old-fashioned view. And in that sense, it seems to me what we must realize is that this may be only a forerunner of things to come. People that know a lot more about public health than I do tell me that this virus may not be a once-in-a-century thing, as some people think, but it may happen much more often because of the way we are messing with nature and interaction with wild animals. Now, can you imagine if, say, 10 years from now, we have another crisis like this one? I mean, the impact on human lives, on society, on the economy would be devastating. So what we are thinking through in Latin America is that we need a very different way of looking at the way we are developing, and looking also at the impact we're having on the environment, how we're dealing with that, how we're interfering with wildlife, and to revise some very deeply held narratives. Basically, what we have done in Latin America, we have followed a very aggressive, extractive development model, looking at mining, looking at high intensity agriculture, not realizing that maybe we are interfering much too much with nature. And when the next big crisis comes, that, as Dr. Dole mentioned, maybe in the case of climate change, it might be even worse than what we're going through now. So if there is a silver lining in this very difficult moment that we are going through, is that maybe this will be seen as a wake-up call and will make governments and analysts and businesses react, that we cannot go on the same way we have until now. And in that regard, obviously we will need to work together with the international community and with powers like the United States and like China to be able to come up of this very big crisis in which we find ourselves. Thank you.
Thank you very much, Ambassador. Thank you very much, Professor. We have a lot of sympathy for people in Latin America. I think this whole pandemic has revealed that we definitely need to put science above everything else, rather than blindly follow the so-called leadership of any country, especially when that country's track record is not right. And I think this pandemic has also revealed that lots of so-called experience or presumptions may be actually wrong and against science. For example, atmospheric rotation, seasonal alteration, for example. We need to stick to science. And this virus is very deadly, very shrewd, and there is only one strategy against it. That is to fight against this pandemic with science rather than politics. And Latin America is one of the examples. And I think the fact that this virus is raging in Latin America at the same time when it is raging in North Hemisphere speaks aloud about the true dangerous nature of this virus. And I hope people in your part of the world will have enough courage, vision, and wisdom to do the right thing to fight off this virus. Thank you very much, Dr. Hen. And allow me to give the floor to Professor Stanley Perlman, who is Professor of Microbiology and Immunology, Professor of Pediatrics, and the Mark Stinsky Chair in Virology in the Roy J. and Lucille A. Carver College of Medicine, University of Iowa. Professor, you have the floor, please. Please turn on your mic. Please turn on your mic. Thank you.
Sorry about that. I have that.
Loud and clear. Thank you, Professor.
Okay, sorry. So what I decided to focus on is the last question on the list, which is coronavirus trend. I'm a longtime coronavirologist, and I'm not expert in actually some of the things that were discussed already. So the questions that I was considering were, what are the future trends of COVID-19? And will life go back to normal soon, or does the world have to live with this virus for a long time? And what will normal life look like after COVID-19? So just a few comments that as I was thinking about this and as I was listening to the other talks. So the first thing in terms of the impact on research, which is the thing that I know best, I think that the pandemic has actually brought out some of the best thing in researchers, whether there's much more cooperation across laboratories within countries and across countries. I think that even at the highest levels, as has already been mentioned, American and Chinese and other scientists are discussing various issues. I can't tell the number of webinars and science sessions that I'm on. One of the things without travel, it's much easier to set up a scientific meeting so that they seem to occur about once a week. So we discuss many of the issues about how to control the virus and how will a vaccine look and what do we really know about how the human is reacting to this virus. So that's been a change that's really been for the better. And the other thing we have now is research is now published before it's actually accepted in journals. Most of the time, this is a good thing because it allows exciting findings that other groups can build on to be provided to the larger scientific community without waiting. Sometimes, of course, we get information that's incorrect put online, but because of the way things are done, it's actually, this comments on incorrect information very, very quickly. So there's been papers withdrawn within 6 to 12 hours after others have pointed out that the data are actually incorrect. And then the other thing I think about is in 1918, the 1918 flu had a lot of similarities, as we all know, to this pandemic. Yet I think about, when we think about the world in 1918 and 20, at least the way I was taught about it, was that it was really a reflection of World War I, and the epidemic or the pandemic was part of it, but not a major role. And I wonder if people will look back at this time and say, well, these issues of globalization and nationalism were really important, and the pandemic was just an accelerator of some of those processes. I think as we live through it, we don't think about that at all like that, but I wonder in the future how that'll occur. Another point that I thought about was one of the questions was about vaccine distribution. I think one of the important questions, even before distribution, is whether vaccines will work. And we don't really know what you need to protect people against this SARS-CoV-2. And we assume we do, but we don't really, and we don't know about so much about these 150 different vaccines that are being developed, whether they're going to be safe, whether they're going to be efficacious. And that is equally important even before you get into issues of vaccine distribution and use, because you want to make sure your vaccine's working. And the way we're doing things by necessity is so fast that this is really an open question about how well we're doing. And so what I really was going to think about was how the changes were going to affect everyone's lives in the short term. So this pandemic is having huge effects at the individual level. We've talked a lot about the societal levels, governmental levels, but at the individual levels, watching people have to stay sequestered in their homes for months, this is not fun for people. People who are poor or need the money to buy food, this has been an absolute economic disaster. And so that's the reason, of course, the countries are opening up sooner than they probably should, because there's such a concern that economically the world cannot keep going on the way it's doing. Having the science run it, of course, is the right way to do it. So you have to balance between those kinds of both the economic and scientific issues. I know in the state I live in, the state never closed down, so it has not ever had a decrease in cases. And as a result, we have a plateau number of cases occurring. But in other states, they're opening up much sooner, and people are ignoring the mitigation measures that we know work, social distancing, hand washing, and as a result, the pandemic is taking off again in these places. So the question is, how will this end? Certainly, if you have enough cases, you'll end up with herd immunity in the way we don't want to get it, which is people getting sick and developing immunity like that, because we know that the main cause of death in this disease, or the main people who die, are the elderly. Nursing homes account for a huge fraction of the deaths. So not using mitigation procedures and letting herd immunity develop in the way it might will certainly result in a different world, but not the world we like. And so how long will it take for the pandemic to end? Watching coronaviruses, I'm guessing it'll take about at least 18 more months, but this is just a guess. It so depends on whether these vaccines work and they're widely accepted and used. So maybe it would end sooner than that, but I would guess it's going to take 18 to 24 months if things are not, if we don't do something to stop the pandemic sooner than that. And another example is we wonder if one of the cold coronaviruses wasn't really a pandemic virus around 1900, a virus called OC43. And this virus now causes the common cold, which is what we hope COVID-19 will turn into. And OC43 occasionally causes severe disease in the elderly with great mortality. So the other kinds of effects are kind of obvious that people, I think, have talked about. Large gatherings are no longer going to occur for the near future. Concerts, sporting events, scientific conferences really are going to be on hold for probably at least till the end of 2021. I hope that's wrong. People are using restaurants and bars less, mostly restaurants. Bars seem to be too much used, at least in the United States. And of course, there's more working from home, which decreases social interactions and exchanges of ideas. And I think it's also bad from another point of view. It may be good from getting more work done, but increasing the kind of isolation is also what we're doing at the national level as each country tries to do things by itself. So doing this at the individual level, I think, is also a problem. And of course, with less travel, we're less time in airports. But because of this, at meetings, we have less exchange of data. And also when you're traveling, even though it was a pretty annoying procedure a lot of the time, it did give you a chance to sit in an airport and have actually nothing to do except maybe read or and then sitting on an airplane, the same thing. When you're at home on Zoom calls all the time, it's very hard to catch your breath, as it were, because you're always doing something. So this is another kind of change that may be incorporated into the world for the next couple of years. I've already mentioned for scientists, there's less interactions. Places to live are different. I know some of my children live in New York City, and I know the population of New York City, particularly Manhattan, has decreased. So it'll be a while before people return to cities. And we know that cities are really centers of innovation. So how this will affect the future innovation is really a question. And of course, in the US, shopping has changed a lot. It's now online, and shopping done in person is actually becoming much more not profitable, and stores are going out of business. And working under crowded conditions may be less popular. Places like meatpacking plants, which we have several in Iowa, which I sometimes talk to people at, it's going to be hard to convince people that they should work in an atmosphere where people are so close, infections spread so readily, particularly with viruses like COVID-19 virus, which we know likes to spread in areas with poor ventilation that are cool and dry. So I think there's going to be changes in that way as well. And as a corollary of this, we're going to have increased recognition of the importance of ventilation. There's also one of the things that's come out from many of the Western countries is this use of universal incomes to make sure that the poor have enough food to eat and that the whole society doesn't go belly up economically. Whether this will be incorporated into long-term decision making, I don't know. And I think that on a personal level, people are much more aware of their environment, being careful about what they touch, and if they have an infection, staying home, recognizing staying away from other people who might have an infection. There's also roles of public transportation, whether that's going to decrease, though that seems to so far not have been a major contributory factor to people's behavior. And finally, this is the area that's been discussed much already, so I'll just mention the effects on the relationship between countries. One would have hoped that countries would join together to defeat a common enemy. We certainly know that that's not true, and that has been discussed. Instead, nationalism has taken over. And these include lack of openness, denial of the extent of the problem, blaming other countries for various aspects of the epidemic. And I fear that this will make cooperation less likely rather than more likely. Certainly, the WHO has a huge role in making this more likely, and we just have to hope that we can get back to supporting it in the US as fully as possible. So with that, I will stop.
Thank you very much, Professor Perlman. What you study and what you specialize in is exactly what mankind needs at the moment. And if I have another life to come, I want to be your student in virology. I think this is really very, very important for our future generations. And what you suggested are very relevant, and I hope government officials and practitioners throughout the world will give heed to your good advice. And I hope you do have a crystal ball of science so you can tell mankind what is coming in the coming days, weeks, months, and possibly for the future generations of mankind. Thank you, Dr. Perlman. And now, last but not least, let me give the floor to Dr. Zhang, who is a professor at Peking University, is a specialist and member of the Experts Council in CCG Academic Committee. And I've known Dr. Zhang on many occasions. He has taught in China. He has taught in universities or colleges in the United States. And Dr. Zhang, you have the final words for our panel before Q&A session starts. Thank you.
As usual, the Q&A is going to the most interesting, and I'm a political scientist by training. I don't have too many things to say, but first, it's just to echo the sentiment that already expressed before in terms of data sharing. We don't really want to see a situation where a country, any country, China or not, that's the first to declare an epidemic. Okay, sorry. Is that okay now? Okay. Let me just repeat what I said. I think I forgot to turn on the microphone. In terms of data sharing, I think it would be a disaster for the entire world if we have a situation of a country, whatever country, China or not, being the first to report an epidemic, to get the first, to become the first to be punished, or to, either individually or in as a group, result of group work. And let's face it, doctors, epidemiologists, CDC officials or not, they're humans too. Humans make errors. And what's troubling me is in this call for transparency, this demand for data information, there is this idea that you need to share the samples. Okay, that's medically sound requirement. Genetic sequencing data, that can be done via the web. The instruments are the same, methodologies. Now, then the third point of data to share actually is not a Chinese or many countries making. It's this surveillance data of a larger population, not those directly affected. You have privacy issues. But the data of a more general populace, medical data, is so essential for vaccine and medical products treatment. So sometimes we are tying the hands of medical professionals, and with this demand for data transparency, and then you couple that with privacy or other kind of restriction flow. And then last but not least, there was this reference, there has been reference that countries need to share the data of an administrative process in responding to a crisis. Gosh, this is so totally threatening to any political system, because so many decision-making in the initial stage, at least, is chaotic, and a lot of administrative procedures or not, information is content or situation specific. So what I'm really saying is a very useful lesson if we talk about cooperation is we go back to say what exactly is it that you do need to know to get the job done, rather than making this an open-ended sort of name and shame, you know, and we simply brush that aside as geopolitics or leadership style. And secondly, let's also face it, there are serious limits to international cooperation, right? Medical treatment or medical service is very much like firefighting. It's first and foremost geared towards your community, your country. This is not being nationalism. And so when we talk about lessons to learn, to share, or to, in these kind of situations, we need to be realistic. What lessons may be applicable? You know, we need to leave a lot this to science rather than to policy. And between different countries, you will need a stock of cooperation in terms of the track record of institutional cooperation and that between the professionals and individuals. And if that's the thing, I would think, between the US and China, that people often forget. We kind of talk about the US and China in general sense. Earlier, Professor Stanley Perman said we have many webinars, but if you look at, we don't just have COVID-19 to deal with. We have lots of things to deal with down the road. You know, the curve on student exchange, on basic science, the never-ending scoping of national security, or simply status or competition, that puts a negative cap on the potential of interactions and mutual learning in the basic science, beginning with college students, and also affecting, let's say, budgeting for our health institutions like Centers for Disease Control. So those are the kind of things I think when we talk about big power, or by reference, by extension, China and the US, we need to come back to. I say a few more words about vaccines, then we go to the Q&A. I stop. It's very unfortunate that at this point of time, the availability of vaccines is again getting tangled in discussions about geopolitics, right? This issue of trust. I read news that questions whether or not, I've heard actually directly from diplomats based in Beijing. We are now beginning to have some limited face-to-face meetings, right? Can a Chinese vaccine be trusted? Isn't China not facing the issue of trust? Now, these are useful questions, but it cannot be allowed to go, let's say, unchecked in some way. I don't know who is going to check it. But what the good news is, you know, the positive side is that World Health Organization were not companies, so we have professionals, university professors who can use medical instruments to measure the quality. But unfortunately, we live in a real world. And in that regard, a very important lesson to learn is not to let politics again get in, very much like the use of personnel protective equipments made in China. There were some quality problems, there was some mismatch of standards, but in societies more than one, there was political pressure to say, use anything but made in China. You can use a recycled face mask, that's safer. It's so Chinese, it's so red, it's so communist. You are better off using a recycled face mask. What are we doing to ourselves? That's ridiculous. It's, you know, you don't need a Chinese professor to remind you that. So we need to see, so with vaccines, and again, very much like what I said earlier on with data sharing and information sharing, you have this person privacy issue. Vaccine, a big issue here is intellectual property of the companies that produce the vaccines. And what we should be doing, we meaning research people, government, in think tanks or universities, should be encouraging the pooling of intellectual property rights, and so as to speed up the marketization of successful vaccines, bearing in mind what Professor Perman said. First, to make it safe, we accept it as safe and effective, let's say effective. Patent pooling is a good direction to go. And then there has to be less politics, way less politics in licensing the production of the manufacturing of vaccines in those countries that don't invent them, that don't have the capacity to invent them. Bring the production, the manufacturing as close as possible to the needed users. Earlier, David mentioned Africa, and Ambassador Haim mentioned Latin America, because this is not a trade deficit or trade surplus issue. This is something, eventually you get better consumer, let's say, support by first bringing vaccines closer to them and their families. And then local production. And then last but not least, I would think if the WHO of the word travel associations are still can be made to play a role. We should probably think of a vaccine list that contribute to a health passport of sorts, so that we can allow we can speed up the reopening of international travel, especially for businessmen, for students, for family reunion. These essential travelers, they should be able to access vaccines on a massive scale so that international travel can reopen fast. These topics are still, I wouldn't say hot, I mean, attractive, and I've said what I had on my mind. In the interest of time, let me thank Dr. Gao and others for having me on the panel. Thank you.
Thank you very much, Professor Cha, for your wonderful speech. You may or may not know that Dr. Cha has a very interesting family name. Cha in Chinese means to look closely or to investigate. So when Dr. Investigator investigates something, I always listen very carefully. And I hope your analysis of many important issues will be of relevance to all of us. And I hope you will give us a speech about masks. These masks are not simple things. They are not just a piece of cloth, for example. And therefore, I completely agree with you. Let us put science ahead of hearsay or politics or ideology. We can fight off this coronavirus with science. And I think the deterioration and collapse of cooperation between China and the United States in terms of fighting against this coronavirus is making at least one entity very happy. That is the virus itself. They are gleeing that China and the United States are not cooperating in putting off this virus, because the lack of cooperation between China and the United States creates more opportunities for this dangerous, lethal virus to prevail and to prey upon mankind. So let us appeal for resumption of cooperation between China and the United States so that all the countries, all the people, mankind as a whole can benefit. Allow me to wrap up our panel presentations. Time is short, and with your permission, may I extend our webinar by about 10 minutes, and we move immediately into Q&A sessions. And I have Dr. Ye Baxin, who is Deputy Director of Hematology in the Wuhan University Hospital. And Dr. Ye has been giving webinars like this to more than 20 countries in the heat of this pandemic. And thousands of doctors in these more than 20 countries in the world have benefited from his presentations on webinars about the pandemic and how to proceed with our work to fight off this pandemic. Dr. Ye, if you are still online, please raise your questions. Thank you. Dr. Ye.
Hello?
Thank you.
Okay.
Please, with your question, please.
Yeah, thank you very much. And a very good speech in this morning. And thanks the CCG's organization. And as a Wuhan doctor and a Chinese doctor, and the COVID-19 has been defeated very successfully, and the life has become common, right? I think, and how to do, and the Chinese doctor or Wuhan doctor contribute to help other countries to combat COVID-19. I wanted to share my opinions, especially and the Wuhan doctors or Chinese doctors has very good experience and on how to deal with this COVID-19 patient and how to prevent the virus spread, right? So recently, and to better promote the communication between countries and countries, we are organizing the many doctors from the world, right, to write a very good academic writings. These writings and will help different doctors from different world to come together to share their opinions. And I hope, and this is a very good way to help help other countries to combat this COVID-19, I think. And in the future, and the communication and cooperation between countries is very, very important to combat the COVID-19, right? And facing their lives, facing the dilemma of different countries and different people. So the academic cooperation between doctors, between scientists, is very, very important. So, and in the following weeks, we will try our best to publish our academic writings and for the world. I hope the day will become as soon as possible. Thank you very much.
Thank you very much, Dr. Wu. You are a hero in my mind, and may I use this occasion to express my and our respect and appreciation for all the doctors and nurses in the former epicenter of this fight against coronavirus in Wuhan. People in Wuhan suffered a great deal, but they fought off this coronavirus in a very heroic way. You mentioned that China defeated coronavirus. I hope this is the case, but we need to be humble, and humility is a virtue in the fight against coronavirus. Never say defeating the virus. We always need to be very, very careful. I keep wearing masks everywhere I go in China, and let's hope that this virus is really put off, not only here in China, but globally, everywhere in the world. Thank you, Dr. Ye. Now, secondly, we have a written question by Global Times. It said, how do you review the current concern of some developing countries that they may miss out on the early access to vaccine in favor of wealthy countries? This is truly a very agonizing question that many developing countries in Africa, some in Latin America or elsewhere in the world are faced. Do any of the panelists have a question, have an answer to this question? And also allow me to welcome back Dr. Wu, who is the chief epidemiologist at the China CDC. Welcome back. Thank you for rejoining us after your important meeting separately. Thank you. Any answers?
Yeah.
Thank you.
Yeah, I think I want to respond to your question about accessibility for the possible vaccine in the winter. I think in China, Chinese government made a commitment. So once the vaccine manufactured in China are available, it will become a public product. So how to define, how to make that accessible, I think it's the government consider how to provide the good quality and available, accessible to developing countries. That's the motivation for Chinese government to make that statement. At the same time, WHO is now working to have a plan making sure all people in the world have equal access and does not limit developing countries have less accessibility to the available vaccine. So all the efforts are now trying to improve the future equal access to possible vaccine. Over. Thank you.
Thank you very much, Dr. Wu. I think we really need to make sure that vaccine, whenever it is produced and delivered, should be international public good so that people throughout the world will have access to it. And it will be a sad situation if any one country can monopolize the supply or the use of the vaccine. And I think this is truly an occasion for all of us to make sure that international cooperation will prevail and will trump everything else. Thank you. Now, I learned just now online there are 330,000 viewers joining this live webinar. And I thank all the viewers, all the audience members for your patience And I hope you will also raise questions, if not right now, but also online later. And Dr. Wu, I have a suggestion. I hope you will give us permission to put your presentation about chronology online at CCG and to be shared with all the panelists and whoever in the audience who are interested in getting your chronology about what CDC did in the first few weeks of the fight against the coronavirus. Now, any other questions from the audience? We still have a couple of more minutes to come. Now, if not, given the time restraint, may I finally make a few points. I think it is a great pleasure for CCG and especially for me personally to attend this webinar. This is very, very timely and very important about international cooperation, especially cooperation between China and the United States in the fight against coronavirus. Mankind needs such China-US solidarity and cooperation. And I hope we can put off politics behind us and let us do the right thing here in Beijing, there in Washington, and everywhere else in the world, because the virus is the common enemy of mankind. It's not just an enemy of the American people or the Chinese people. It is our common threat. Let's deal with it as it is. Let us ensure that science prevail and politics or conspiracy theories fall apart, because they are hindering our mankind's fight against coronavirus. I would also like to thank all our panelists, Dr. Wu, Professor Altman, who is still with us just now, even though it's very, very early hours in Germany. I would like to thank Dr. David Dollar, Professor Huang Yanzhong, and Professor George Hen, Professor Stanley Perlman, the great virologist, and Dr. and Professor Zha Daojun of Peking University. And I would like to thank the roughly about 750,000 of global audience listening into this important webinar. I think CCG is very honored and very privileged to provide such facilities. And I hope we can re-engage with our distinguished panelists once again very soon. I believe such exchange of ideas, bouncing off ideas, raising issues from the different assets of the same complicated issues are very, very important. And allow me to express our gratitude to everyone involved. And I wish you good luck. And I wish all of you keep safe and keep healthy. This is the most important wealth that we can enjoy in this fight against the coronavirus. Keep safe and keep healthy, and keep your family members safe. And at a larger sense, keep your whole community safe. This is the minimum we can do for ourselves, for our people, for our country, for civilizations, and for mankind as a whole. I wish you good luck. God bless you. Thank you very much. Thank you.